Hi guys, and thank you for being on our video today. Are you on our video or are you watching the video? I think you're watching the video. Thank you for being here. And you know, every profession I'm sure has conversations that you have over and over and over again. And the talk about fungal nail medication and why people get fungal nails is one that you've heard on my channel over and over and over, but the patient hasn't heard it. So we get to have it again. And she's a hoot. She had us all laughing. She kept being surprised by my assistant who was behind her working the camera. And she had the whole room laughing. So she's really sweet, and I hope that you enjoy our video today. And I've almost never, I can't say never, but I've almost never had to stop anybody and take them off the medication because of problems with the liver, but everybody knows it's a possibility. Yeah. So I'm gonna lift you up just a little bit more here.
And
Hit the wrong button. Sorry.
there was one you were talking about that, and I'm also on for CLM. So
You know,
I assume that's why I've got the nail fungus. I didn't have it before I started on it.
It's very possible. You know, when you are fighting something like leukemia, you're very immunocompromised. And so your body doesn't recognize the fungus like it used to. So, so could the chemotherapy for your leukemia, your chronic leukemia, could that have been what allowed this to happen? Yes. Because the fungus is just out there in the community, and some people will get the infection in the nails and some won't. And it can be a genetic thing. It can be, I mean, what could be genetic about it is whether your immune system recognizes it or not. But it doesn't, you know, contrary to what you see on, you know, Facebook commercials and TV commercials, it does not go into your system.
Okay.
It does not make you sick. It stays in the skin and nails.
And is there any reason other than vanity or?
Well, yeah, I mean, if they get too thick, they can cause sores underneath them, but yours aren't that thick that I would worry about it. Sometimes they can be very painful if they get too thick. So, all right, so this is the one that was hurting on this side.
Yeah.
So I'm not going to trim it back super far because you said as it grew out, it felt better.
Yeah.
So I'll cut it kind of straight across here.
Okay. It's so thick. There's no way I could do this myself.
I'll just go ahead and smooth everything out here, and then we'll do the right foot.
Okay.
Okay.
Oh.
That's okay.
I looked for you on the right. You weren't there. I thought you'd left.
Stealthy.
let's switch to the other side.
Should I be coming in to have you do this every once in a while?
Wouldn't be a bad idea.
Okay.
You know, because your circulation's not great. Insurance would pay for you to come in and do this as long as there's 2 months in between.
Uh-huh.
Well, it also depends on your insurance.
Yeah, it should.
Who do you have? The Advantage plan?
No,
Oh.
the
The supplement?
just the regular, I mean,
Okay.
not an Advantage plan.
Okay, good. Because the Advantage plan has decided that if you're not diabetic, they're not going to cover this.
Oh, really?
So you could have no feeling in your feet for a completely different reason, but they're not going to cover this care.
Oh.
So it's good that you...
Oh.
Anyway, so yeah, as long as it's between 2 and 3 months is pretty standard. Some people come at 2.5, some people don't need to be here for 3.
Oh, wow.
So what I usually do is I'll start people at 2.5 months, so like 10 weeks.
Uh-huh.
And then at that next visit, we can decide, should you have been here sooner? Could you have gone longer? And we can adjust it at that point.
Oh.
How's that sound? Kind of like your husband comes in, you know?
Yeah.
You know, now if you can handle everything except the big toes, then sometimes we'll just have people come in a couple times a year and you manage everything else and I take care of the big toes. So that's another option. It's whatever you're more comfortable with.
I'm sorry. I want to look at you.
Oh.
I keep thinking it's going to hurt. Well, it's a little uncomfortable.
So there's just a little piece digging in there. Okay.
This is the one that years ago I had one of them had an ingrown toenail. I don't remember which now. I think it was this foot. So you are able to scrape off that extra.
The thickness?
Yeah.
Yeah. On that right big toe, you see this transverse line right here? It kind of goes across?
Yes.
That tells me that there was some injury to the nail back here, probably 6 or 8 months ago, and the nail stopped growing and then started growing again. So most of what I took off was the old nail being that you're already kind of pushing out like a baby tooth. So I'm thinking it may not get that thick again, but we'll see.
Well, it's okay to get pedicures. And what do I tell her, just to sort of not pick around at the,
Yeah, I would just tell her, you know, these don't need to be trimmed any further back.
okay,
She can certainly smooth them out and make them look nicer.
uh-huh.
Lord knows I don't do that part. I hear that enough on YouTube. What a horseshit job I do of making them look nice, but they're comfortable. Does that feel pretty good now?
Yeah,
Okay.
So she can smooth it off, but we're talking about the big toe.
Yeah, I just wouldn't have her dig down on the sides.
Okay,
But she can thin it out, she can shorten it, buff it up. Any
Okay.
of that is fine.
all right.
Okay, are you wearing socks today?
Yeah, oh yeah. That's all right, I can give them.
No, I'll do the, when I put lotion on, I'll always do your socks because
Oh,
I don't want people slipping on the floor.
oh,
I'm a foot doctor, I don't do head trauma.
I wanna know now, do you put a video or audio with this, the
Yes.
video?
Yes.
Okay, so when is it gonna be posted?
I can, hang on, keep going.
We keep going.
Yeah, I can get this up next week if you want.
I don't care when, I just wanna know when to look.
A couple weeks,
All right.
okay? All right, well, thank you for letting me do the video. You're a star. What?
She's speechless.
All right, well, thank you, and we'll, yeah.
Wait till I tell my kids.